On March 23, 2010, President Barack Obama made history by signing the controversial healthcare reform. This health reform will make healthcare more affordable, make health insurers more accountable, expand health coverage to all uninsured Americans, and make the health system sustainable. It will stabilize family budgets, the federal budget, and the economy.
So what the heck does that even mean?
That's why we're here to drop some knowledge on the new healthcare reform.
Who will even be covered in this bill, you may ask?
There's an estimated 32 million Americans who are currently uninsured. That's a lot of cheese. The people who are uninsured, self-employed, or work with employers who don't currently offer insurance are included in this number and will be able to browse for insurance. The cutoff level would be a person with over 4 times the federal poverty level. For example, for one person, that's about $44,000 a year, and for a family of $88,000 a year. The main idea here is that the legislature wants to provide health insurance to everyone in the United States. That's a heck of a lot of people. How much is that going to cost?
The new health care bill is going to cost $940 billion over the period of next 10 years. There's all this talk of possible deficit reduction. Does anyone even know what that means?
A budget deficit occurs when an entity spends more money than it takes in, but the bill is going to reduce that. With the new bill, there will be a $143 billion reduction in the deficit over the next 10 years. $53 billion of that total will come from the Social Security payroll taxes that eventually will be paid out in the form of retirement benefits. $70 billion of the $140 billion will come from premiums collected from a new government-run long-term care program for the elderly. CBO says that the bill is predicted to cut the deficit over the next 10 years. This means that the deficit will have to raise a little more money than it will actually spend. So if everyone will be insured, won't there be insurance mandates or things that insurance companies will have to do in order to make that happen?
The insurance companies have to do things in order for Americans to have insurance. 6 months after the enactment of this bill, insurance companies can no longer deny children coverage based on a pre-existing condition, or anyone for that matter. Insurance companies also have to allow children to stay on their parents' insurance plans until they reach the age of 26. But what if Americans don't take advantage of this and don't buy the insurance?
They get put into jail and have their arms cheese grated every hour while listening to Justin Bieber on replay. Okay, not really, but there is a fine. The fine for Americans who don't buy insurance will be 2.5% income, or $695, whichever is greater. There are exceptions for poorer Americans, and Uncle Sam will be sure to help. There sure is a lot of money being juggled around in this bill. Where do they think it's going to come from?
There definitely will be an effect on taxes. There will be a Medicare payroll tax, and starting in 2012, if we're all still alive, the Medicare payroll tax will expand to include unearned income. This is a 3.8% tax on investment income for families making more than $250,000 per year or $200,000 per individuals. Beginning in 2018, there will also be an excise tax. Insurance companies will pay a 40% tax on so-called Cadillac high-end insurance plans worth over $27,500 for families. Dental and vision plans are not included in the total cost of the family's plan. There will be another tax called the tanning tax. All indoor services will have to include a 10% tax. Outdoor ones will still be free of charge, including the creepy neighbors. Will this healthcare bill have an effect on prescription drugs?
It will have an effect, so much that they have a crafty name for it, the donut hole. Under the current healthcare law, Medicare stops covering drug costs after a plan has spent more than $2,830 on prescription drugs. It starts paying again after the individual's out-of-pocket expenses exceed $4,550. With the new healthcare bill, it will be closed by the donut hole by 2020. An annual fee will also be placed on pharmaceutical companies in 2011 based on their market share. This won't include companies with an income of $5 million or less. How are employers going to make sure that all their employees have health insurance?
Now, technically, there is no employer mandate in the new healthcare bill. However, employers with more than 50 employees must provide health insurance. They can also pay a fine of $2,000 per worker each year if any worker receives federal aid for their insurance. This is called play or pay, because companies can either play and provide the insurance or just pay the fee. What effect will this have on small businesses with less than 50 employees?
Small businesses will be exempt from the pay or play policy. Instead, they will be able to get insurance through small insurance exchanges. This will allow them to pick through policies and insurance companies for better coverage at lower costs. Will those Americans who are having trouble finding affordable health coverage have the option of any subsidies?
Subsidies make coverage available to families that otherwise could not afford it. One way that the new healthcare reform will get the coverage to everyone is to increase insurance programs such as Medicaid to the poor and near poor. Medicaid will expand to include 133% of federal poverty level, which is $29,327 for a family of 4. In 2014, it will also be mandatory to expand Medicaid to include childless adults. Federal government will pay 100% of costs for covering newly eligible individuals through 2016. About 20 million Americans will be able to qualify for subsidized insurance. Where is all this money going to come from to pay for a bill of this epic proportion?
The majority of this money is coming from taxes, primarily taxes from more wealthy families. Originally, it was from surtax on Americans who make over $250,000 annually, but it's recently been bumped up to over $350,000 annually, kind of like Robin Hood. The healthcare bill will impose an excise tax on insurers of employer-sponsored health plans that cost over $10,000 a year for individual coverage. This tax would be 40% of the cost of the plan. Abortions and paying for them is a controversial topic. What is the new bill going to do about insurance paying for abortions?
The new bill will require individuals to pay for abortion by making 2 separate payments. No healthcare plan will be required to offer abortion coverage. It's up to the states if they want to make that coverage.
Wow, I was not aware that the healthcare bill was so easy to understand.